Good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk this morning about something that is very important in our oral health and also in the health of our bodies, and that is the the shortage of vitamin D3 or D2. D2 is where they manufacture the material, and what we call vitamin D is really not a vitamin. It's more complicated than that. It has some of the characteristics of a vitamin, but it's really not a vitamin. It's far more important than that. And it has an effect on so many things in dentistry and in health that it seems like we're just now taking this into account and trying to do something about it. Now, most of the time, vitamin D3 is created by the ultraviolet rays of the sun. And by the way, when the sun shines through glass, it knocks out the vitamin D formation ability of the ultraviolet rays in the sunlight. So you have to get outside some way or another. And people are spending so much time inside nowadays, and we're doing computers and everything else that is inside, and we don't have to go somewhere to have a lecture. We can just all get together on the computer, and so people are coming up short of vitamin C, and vitamin D, excuse me, and this is something that we really need to take into effect. And I've picked out a patient here. It's not really a vitamin D patient, but she has an impacted molar tooth that is ankylosed, and it was very hard to get loose, and I'll discuss that. And we'll just discuss the tooth structure. The whole structure of the tooth is affected by the amount of vitamin D that a child is getting while they're growing up and forming. And if they don't get enough vitamin D in there, the enamel structure and the dental structure and the cementum in the tooth is not sufficient to withstand the problems that are going to come up through life on the tooth, the problems that be given to it. So let's get on talking about this. This is let me get my little deal going here. I think we've got it. All right. This model that I'm showing right here has a 6-year molar that is ankylosed. It's down in here. We're going to show it on X-ray. And to break this thing loose and get it up where it would come on up here where we would be something like that, it was very difficult for us to do. And this is true with any tooth in the mouth that gets banged up on something. I might just try to draw a little bit here and show that. I'm going to erase this. Say this is a tooth structure that we would have. Down here, and if you get a severe blow on the tooth, let's just run through the parts of the tooth here. Now, your enamel covers part of this in here, and enamel structure is unreal how hard it is. And if you want to wonder about that, just look, my next birthday I'll be 94, and these teeth that you're looking at right here have been in my mouth. They were forming when I was 3, 4, 5, and they came into the mouth around 6, something like that. And so they've been out and exposed to everything for about 88 years, something of that nature. And if I lived as long as it took to wear these teeth out, eating the food that I eat right now, I guess you could live to 300 or 400 years before they'd wear out. Now these have been in my mouth for about 88 years, and I have chewed everything you can think about on this, but not something gritty. Now, what people, I've told you this before, in certain groups of Indians that were they lived in the area of San Angelo, Texas, where I kind of grew up, went to high school there. Excuse me. And I went out to Fort Concho, which is right out of San Angelo there, and it's really in the edge of San Angelo. And back then, we had a lot of Indian skulls that were demonstrated there. I didn't mean to be disrespectful of the Indians that passed away in this battle, but most of them were somewhere around 18 to 24, 20, and most of them were teenagers. They were really just young men, and there wasn't a tooth in that whole stack that had any enamel up above the tooth. They were worn down flat, absolutely flat. And the front teeth out here that normally would be something like this, those teeth were worn off somewhere around like that, and just flat. There was no deep bites that we have today, and this is something I wanted to stress out. And now I've chewed with my front teeth, and I bite things with them, and I use them, but and they're still down here, and my lower front teeth come up something like this, and we have a little bit of overjet, which is normal in here. And the way this contacts right here, when we go to bite something, you open your jaw or you move it down this way, and this tooth right here will come up and touch that part of the upper tooth, and now I can cut off something. When I bite with my front teeth out here, these teeth back in the back are brought apart by this much movement right here. In other words, they won't be touching anywhere in here, and so the only thing that is coming in contact will be, this is the fossa back here, and this would be the condyle coming up, and the jaw would be coming around this way, if you could excuse the drawing here. And this is the disc. It's in between here. And when you slide your jaw forward, this is still in contact right back here, and it's in contact back here, and the muscles are in this part of the jaw closing it too. Their muscles are much closer to the jaw joint than they are to where they're working. You can put your finger on your jaw right here and bite down, and you can feel the muscle right in there. Just put your finger, push back in there, you can tell the muscle's usually somewhere on the second molar, right over the second and third molar, maybe some on the 6th-year molar, and the load is back here. So if I bite out here, I slide my jaw forward, and I bite with 10 pounds of force out here, I will have to have a lot more force on this pressure area here than the 10 pounds, because this is the distance from the muscle to the contact point, and from the muscle to where you're contacting out here may be 2 or 3 times as much. So to get 10 pounds of force out here, I might have to have 25 pounds back here. Now this is varying from what we were talking about, but this is just a fact of life. Now these young men had their teeth worn off down here because they ate food that was full of grit. They took 2 rocks and ground their corn. But if they had corn or whatever it was they were able to get, acorns or anything, they ate some rough stuff, I'll tell you. And it would have a lot of grit in it that is harder than enamel, and it would wear the enamel down when these men were only just young men right then. And if one lived till they're 40 or 50 years old, their teeth were just ground off to just flat. There was nothing, and they would grind off, and it would wear in between the teeth, and the teeth would drift in a forward direction to close the space, and they had more room back here for wisdom teeth to form. So these are some things about teeth that you, if you're a dentist or even just anybody, you need to understand some of this stuff, the way teeth work. Nowadays we don't have any food that's rough at all, and people will have their lower front tooth to be set in something like this, and the upper front tooth may be coming down something like that. In other words, they've got that much, and they only need about this much space in here. Now these people cannot chew properly. In other words, if you've got a real deep bite, you can't go from side to side. When your overbite and overjet is proper, you can slide your jaw this way and that way, and you can chew much more efficiently. In fact, they say it's about 4 times more efficient in grinding the food up this way than it is just chewing it straight on like that. All right, these are some things about teeth that I want you to understand, and that's why these young Indians that were killed in a battle or whatever they had their skulls there, that was why they had no cusp on them at all. So they didn't have any overbite and overjet and bite closure and stuff problems that we have today. They did, of course, they didn't live long enough. The life expectancy is somewhere around 40 years like that. All right, let's go back here. I'm going to empty this page and go back where we were on this model. And this is a tooth that is coming in or trying to come in, and its roots are a little shorter. We'll show it on x-ray here, and we're trying to bring it up in this part. Now if you just try to pull it into by pulling down on this, it'll sink these teeth, and this will bring all these teeth down to this point. I've tried that. That's not the way to deal with them. you have to go in around it, and you have to break this thing loose, and then you can get it to move. But when a tooth is ankylosed, maybe it was damaged at some time, or the guy was hit in the mouth or something, and you've got, I want to go in and show another blank sheet here, and let's just draw this tooth in here, setting it some angle like that, and the roots would be coming off. And in here, and the other tooth was up here, and there'd be a bicuspid in this part, right here, and it'd be in contact, and you couldn't get this tooth to come in there. Now what we had to do is push this back, and push this back, and make space enough to get this tooth to come up. And then we had to go in and either send it to an oral surgeon, or if you know how to do it and you want to put an instrument around this tooth and move it, then it would break the bony attachment over here. Let's just say that this is this root coming down like this, and it got hit real hard and was bleeding, and when you take the blood will form and make an attachment sometime, and the bone would grow together here, and then this tooth will not move. You can't move it in normal ways. Now, you say, if you can't move it in a normal way, how do you do it? Well, you have to come in here with something and break it loose, just like you were going to extract it. And now you've got to keep it moving. Now, the normal way the teeth are joined together is something that people need to know. Let's just say that this is a root structure here, and this root is covered with cementum. It has attachment, and then there's bony structure out here and all around this tooth, and we have a nerve canal, and we have a blood vessel, an artery, and a vein, and a lymph vessel going up inside this root right here. Now, this periodontal membrane, it goes from the tooth, the bony structure of the cementum on the tooth root, into the bone, the alveolar bone supporting the tooth. And this is the thing, if you put pressure on this little ligament through here, there's thousands of little wire things here, make your periodontal membrane in here. If you put pressure on it, there are little osteoblasts that come in and move, osteoclasts really, they remove the bone structure around here, and over here they build them up on this side, and this tooth will move in that direction. But if this is damaged and this bone here is grown to this like it is over here, then this tooth will not move. It's just like when we put one of these little screws in the tissue. It's got threads on it and everything. You got a head on it, that's your screw, and it's down in the tissue, the bone. You try to get it in cortical bone. If you can, you don't get much in it. This tooth, this screw will not move unless you move the whole cortical bone around. And that's the way we put these tads in and pull on them, and you pull teeth around. That's what happens there. Now, if you, let me get, I'm going to erase this and go back to another page like this, And let's just say, here is our root structure, and here is the bony structure, which is the alveolar bone around the tooth, and you've got a layer of cementum on the root, and you've got the periodontal membrane going across here. There are literally thousands of these little wiry, hair-like structure across here. They're probably not that big, but if you put pressure on this tooth in this direction, it will send these osteoblasts or osteoclasts, I get them mixed up here, and they're little, you think of them like they're little brick masons or something. They'll be tearing it down over on this side, and they'll be rebuilding it over on this side. But the rebuilding takes a lot longer than the tearing down, and so you can move that tooth over. In fact, you could move it over here if you wanted to, if you just kept easing it along there, and it'll move over and the bone will go with it and everything. That's what I want to tell you. Now, if somebody comes along and they've got a deficiency in vitamin D, if you want to call it D3 or D2, D2 comes from different things in food. There are very few foods that are just loaded with vitamin D. Fish are good, salmon and tuna fish and fresh vegetables and things have vitamin D in them, but it's not enough to where we're really loaded. We need to go out in the sunlight, and the sun hits the tissue right here, and the ultraviolet rays will create a vitamin T that goes here to several different contacts. I want to get my daughter-in-law has helped me with the videos an awful lot, and she is doing a PhD in preventive medicine, in preventive things. And vitamin D is a very important thing, and if you don't get enough of it, the cementum, the bone structure going into the tooth will not be sufficiently in strength. And even if you're around, like I grew up out in West Texas, and we had a lot of fluoride in the water out there. In fact, in some of the towns and areas out there, they had about 10 times more than they should have had. And their teeth would have stained areas all in the structure. It's down in the tooth. But the teeth are extremely resistant to decay or acid that eats into the enamel of the teeth. You take somebody with a lot of fluoride in their teeth and you etch their teeth with acid to try to bond something to it, and you just don't have the success with it that you would if they have just normal teeth without the fluoride. But we try to give them the fluoride. All right? Fluoride joins in with the enamel and makes it harder and resistant to acid, and it is good to have a certain amount of it. Now the vitamin D, or what we call vitamin D, is a vitamin, it has some of the characteristics of vitamin D, and so they called it a vitamin D way back there, and now they're still calling it vitamin D, but it is actually a kind of a hormone device. We'll get more of that in another video. We'll come back and show you that. It's very important to understand. And so I don't care if you're a dentist or if you're anybody. If you're sitting in the house all the time and you don't go out and get sunshine, and let that sunshine hit your skin without going through glass, you don't get the vitamin D that your body really needs. And so it affects the bone structures are supporting the tooth, the enamel that is developing around the crown of the tooth. I mean, you've got enamel, it's under here, extremely hard material. I mean, this enamel on the edge of my teeth right here has been there for 80 some odd years, and I've chewed through all sorts of things, and it's still there. And the dentin is down between, like if I took one of my front teeth, went up like this, went over, it's worn down like this. The enamel here is still there, and the dentinal structure in there will wear down, and you'll have a little groove right in the middle of this where the dentin wears out, but the enamel stays in place. And it is the hardest thing made that lasts. I've got some teeth of these huge elephants that used to live here in the Texas area, and the enamel is still just as good, and it's as hard. It has a dentinal layer between it, and they ate, I think they could chew up wood with that thing. And the enamel is extremely hard, but they wear it down with grit. You get dirt on them, and the dirt's harder. There'll be flint and other things in it that's harder than enamel. And you take a guy who chews tobacco, and they'll wear their teeth out a lot earlier because there's hairy stuff in the leaf of the tobacco, and the tobacco leaf is an abrasive that'll wear the teeth. All right, I don't want to go on forever talking about this thing, but vitamin D is very, very important. And our children, when they're growing up, if they don't get any sunshine, they're not out there playing in the sun. Now you can get blistered by the sun, and there's a lot of difference in the location you are when you're out in the sun. Now, when you're down on the coast, the air pressure is much higher than it is up, let's say you're in the mountains about 20 or 30, like in San Angelo, Texas, it's about 1,800 feet above sea level there. And the sun will blister you there quicker than it will down at sea level. But it stays cooler and stuff. If you're skiing and you're at 11,000 feet and you expose yourself to sunlight, it will blister you much quicker than at sea level. So the amount of ultraviolet rays decreases as it gets closer to the earth, where the atmosphere is much, much thicker than it is up at 18,000, 20,000 feet like that. So we need to get out into the sunshine and let it contact our skin. Now, once you get about, the skin gets a certain amount of it, then it'll shut down. The body won't take any more of it. But the ultraviolet will still work on the skin, and it'll blister your skin. And I don't know how many of you gone out and left your shirt off for 2 or 3 hours and you get blisters. I mean, your skin will actually blister and come off, and it's quite painful. So we need to understand about the vitamin D. It is important. It affects the enamel that forms here. It affects the dentin that's underneath there, and then you'll have a kind of a nerve canal in here that goes down the roots of the teeth, and this blood vessel fills that area in here. And dentinal structure, if you don't get the proper amount, it doesn't form properly. It's softer, it's more subject to decay, and the enamel is too. And I've seen people with teeth that just decayed, seem like almost nothing. It would decay. Now these are people that don't get any sunlight or get very little, or their body isn't able to supply it. And we get bone structure that is broken down. In other words, I've had patients that had osteoporosis, and that's not just oral where the vitamin D is hitting us. It hits us in our jawbone, the bone structure, the nerves, the tissue, the whole of our body is affected by this vitamin. And if you're a person sitting there working on a computer all day and you hardly go out in the sun, you should take some vitamin D3, maybe a good bit of it. So this is what I want to pass on in this lecture. And I just picked this one lady, but that's not what I want to show here. It's really the vitamin D that people need to understand about. And if you, this lecture is not just for dentists or for one group of people, it's for everybody. I mean, all over the world, people are staying out of the sun more, or we put on something that will block the vitamin D and we won't get blistered. You don't want to get blistered, but you do want to get a certain amount of ultraviolet rays into your skin so that you can form this vitamin D3. The main source of it is what we call vitamin D3. It comes from the sunlight on the tissue. The other parts of vitamin D, they call it vitamin D2, and none of it is true vitamin C. But that comes from eating some good food, like salmon are high in it, tuna fish are high, and I'm sure other fish are a good bit. Good leafy vegetables that stand out in the sun, cauliflower, and just a whole bunch of the vegetables have vitamin D in them. And how many of us eat the vegetables that we really need? So these are some things that you want to know about in this type of thing. This dentistry is a good indicator of what's happening to your body. In other words, you pull your cheek back, you look at the gum tissue, and if it's inflamed and it's swollen, and this is another thing that vitamin D and vitamin C, that we got tied on vitamin C and forgot about vitamin D, it seems like. But your tissue will not form resistant to periodontal problems. And let me talk just a little bit about periodontal problems. If we have a root that's coming down like this, you have the cementum that's on the root, and then you have this cortical plate of bone down here, and you've got the periodontal membrane, the thousands of little fibers that are going across there. And when you bite on that tooth, it's got a little give in here. And without the periodontal membrane, the bone will be grown in here. The tooth, you can't move it unless you break it loose. And we know that for a fact. Now, the periodontal, this membrane forming in here does not form properly unless you've got plenty of vitamin D, and whether it's D3 or D2, just plenty of vitamin D, and the body will only take so much at a time. And people that stay out in the sun, you get too much if you aren't careful. Now, it's funny, like in India, it's a continent, something, say it's V like that, and then up here is a Himalaya mountains. Now, the people in India that live in the high country up here are lighter skinned than they get a little darker, and they get hit, and they get out in the southern part of India, and the skin is really dark. The skin develops a resistance to ultraviolet rays, and the dark skin can handle it far better than the light blonde skin up here. But they have to have more vitamin D for a person with dark skin, because it resists the action of the ultraviolet ray. So the amount of vitamin D3 and everything, as a person gets up into the lighter skin area up here, it doesn't take as much sun to get them vitamins as it does these people down here. This is just something that happens. Now, the same thing if you're on a mountain, and up here is 11,000 feet. That's hard for me to draw 1,000, but 11 or 12,000 feet. The oxygen is so thin, the wind blowing over here carries it up the mountain. But it takes very little sunlight up here to blister your skin or to give that to you, regardless of what color the skin is when you come in. Now, you get out here and you see the sea level. If you put on a pot of beans down here, you can cook them real quick. But you put them on up here, you got to have a pressure cooker to get the water boils at a lower temperature up high. You can't hardly put beans on and boil them and cook them at a high altitude. All right, we've covered a lot of territory here, and these are things that everybody ought to know about. You don't have to be a dentist or a medical doctor or whatever you want. You need to understand these problems. So don't sit at home inside, cover up yourself, go out and never let any part of you get involved with the sun. And most people today are doing so much computer work and everything, and myself included, that we don't get out into the sunlight enough. So I'm gonna say goodbye, and I hope that you will take this seriously. And we have a lot of people that tune in to our videos. They don't listen to them or look at them very long, but this one really needs to be understood by people. We've got teeth that have a pulp chamber in here, and we have dent and enamel and cementum and all these things. Amazingly tough, strong to grow. And when I was a kid, I ran around in short breeches in the summertime, and I was as brown as could be, and you got a tremendous amount of vitamin D, but the body would throw off most of it. All right, so I'm going to close up, and I hope you get something from that. The body is complicated. I'm just now getting into kind of understanding a little bit about the particles that the whole Earth's made of, the quantum theory and things of that nature. one of my sons is a doctor of mathematics and physics and teaches that, and he tried to explain it to me. I don't understand that at all, where 2 and 2 is not 4. It may be 5, it may be 6, it may be 3. You can't see these particles get in there. So that's something else that's going to be coming on, and we'll know more and more about it. Maybe we can figure it out. So I'm going to say goodbye, and I hope you'll listen to this. We have a good deal, and I hope you'll tune in to it and sign up with our outfit. So thank you for watching, and may you get something out of this that will help you as you mature here on earth. Thank you again.